Hey, thank you. So welcome to the practical demonstration of the tool that we've discussed in the rest of this workshop webinar. This is really designed to give all the end users, the commissioners and the analysts, I guess, in ICBs, a flavour of what this tool does, what it contains, how we've constructed it, how it's intended to be used, and the kind of outputs that you can take from it and sort of integrate into your own local planning and strategies around inpatient bed demand within your system. First of all, just a very brief overview recap, I guess, on the pros and cons as you think about those and have those in mind, I guess, as we go through the tool. It isn't going to solve everyone's problems, answer all of the questions that everyone has. But again, it's been designed in a way that hopefully gets you to a point where you can think about as a local system where the demand is going, what things you might put in place to mitigate against some of those and the other things which may impact on that future sort of bed stock effectively as you start to plan around those things. But in terms of the advantages of this kind of approach, it's consistent. So every ICB in the region will have the tool, the region will have the tool to access as well. So it's kind of a standard approach, I guess. It's easy to understand. At least each system will be at the similar sort of use a similar baseline, use a similar set of assumptions to actually project where they think their future demand may go. It's a cost-effective approach. It was commissioned from the region via MPFT, I think. I'm not sure the final financial flows, but effectively it's costing each ICB a few thousand to develop a tool. If you were to kind of go out to the open market and do bespoke development, it will cost almost certainly much more. So it's a cost-effective way of doing an at-scale product for all the individual systems within the region. And hopefully the whole purpose, as I've described already, is about making a tool that enables you to scenario plan for different circumstances, different futures, different perspectives on where that demand and mitigation activity may go. By the same token, there are some disadvantages, I guess, cons of the approach that we've taken for pragmatic reasons, some methodological, I suppose. As I said, the scope is perhaps narrower than the entirety of the expectation and the aspirations for the modelling tool, and that's a function, again, of time and resource ultimately. But yeah, so it won't cover everybody's questions. It won't be able to support all of the potential subgroup analysis that you might want to do. So again, almost certainly more local work, more local analysis will be required, but at least it will be an informed debate, I guess, point you to where you might need to do that additional deep dive work and additional analysis, I guess, to get you to a point you're comfortable with. Again, it's a relatively simple design, takes the nucleus of the model. It's effectively counting patients and beds, and we've just overlaid a whole set of assumptions. So we've not included sensitivity analysis, Monte Carlo type simulation to look at different distributions of parameters. It's a very simple, straightforward, move your assumptions around and kind of see what happens. The projections are very simple mathematical calculations. It's an additive model effectively. So again, there's not a huge amount in terms of methodological nuance to the projections. It's not kind of taking straight line or doing time series projection. It's taking that baseline data that Andy has described earlier on in the session and kind of overlaying all those assumptions about the future onto it. A lot of the assumptions, in fact, most of them are global ones. We're applying it to the whole bed base. There's a few which aren't, and we can talk through that. Take questions later. So actually it's not going to be at a very kind of row level, individual patient level. It's not going to be sensitive to all of those sort of populations. But again, taking the global, taking those relative changes in beds that the model predicts, I think will be really useful to systems so they can start to re-piece together almost the way their system actually works to kind of fit into this future view. So yeah, hopefully that gives a flavour. It's kind of just to hold in mind, I guess, as we go through the tool. Just a quick note on access, because I know this will be important and how people actually use the tool. It is live, it is hosted, it's on the web. Currently, we are gatekeeping this initial phase where we're kind of handing it out to systems. Again, that's something we discussed with the region, with the clients, and ultimately we do want to, the last bullet point on this slide kind of alludes to, we do want to make this public so that anyone within the systems and even wider across the whole NHS or ultimately, I guess, members of the public could access the tool to have a play. But currently it is gate kept. It's on a system which requires you to have a user account, which we will then authorize and sort of provide the links and relevant things to. There will be people from our data science team who contact you via the app, the server that it's hosted on, to kind of guide you through that process of setting up an account. We'll obviously then activate those accounts, send you out the links. Currently, it is going to be limited. Again, there's a cost overhead to the licensing around the number of people that can access in this way. So we are limiting it currently to 2 per ICB. I guess we could possibly flex that based on what else is happening with user licenses across our other projects. But for now, that's the current constraint. So 2, I could be a commissioner and analyst. I guess that's for the systems to decide on the best folk within their infrastructure to have those access licenses. But yeah, that is a current constraint, not necessarily a welcome one, but it is unfortunately the practical world that we live in. We will also send you the links along with a data file, which represents the baseline data to feed into the tool. Alex will go through that in much more detail. So yeah, hopefully we're going to walk you through the process. There shouldn't be any, I guess, uncertainty as to what's happening. We're kind of step by step, we'll walk you through the access, all the process to get you a point where you can use the tool that we're just about to show you and hopefully get some really useful information coming out there, and which you can then feed into your longer term plans and strategies. So yeah, I think this is the point at which we would jump out. So okay, this is the portion of the session where we will literally walk through the tool itself. I think again it will be a bit of myself and Alex chopping and changing, taking control of various elements of the model to talk you through it and pick out various functionality and how things work. So hopefully everyone can see, maybe a thumbs up just to show that we've actually landed on a web page and a model. Yeah, Andy, you can see Andy, the only one with his camera on. Everyone else is shy, I guess. So yeah, I'll very quickly walk you through at a high level how we've constructed it, but then sort of hand over for Alex to walk through exactly all the practical steps, what all the things do, what all the buttons do, all the things that you can interact with, and how you kind of get things working and get things out of the tool. So this is your landing page. Effectively, we're assuming all the access plan has worked perfectly and everyone's got their logons and accounts and it's all working wonderfully. You've clicked on the link. This is where you will land. This is kind of the landing page, which kind of gives a very brief flavour of the kind of things that we've discussed again at various stages of the project, just to give, again, the kind of cold user, person who's seeing this for the first time, perhaps just a flavour of what's in the tool and again how it's been designed, what it's intended for, very broadly speaking, and how it works. Acknowledging again that this isn't the perfect thing. It doesn't contain all the information, all the answers or questions that people may have about future demand. We've included some of what we think might be useful resources to kind of complement some of the gaps in Hannah's sort of insight aspirations for the tool, again linking to things around population, mental health, other sort of routine data that's pushed around the national infrastructure as well, which might be useful as you start to think about some of our assumptions and plan around them. There's other useful resources linking out to people like you know, the Mental Health Foundation, other specific reports on transition. I know again that's a thing that came out from the visits, but the scope was adults. Actually, just to clarify, the data that we fed in to the baselines that feeds the tool actually does include the under 18s and the CAMS population, I guess, just for holistic nature. But again, once you take stuff out, you can always filter those out or leave them in if you want to take that holistic view of your total mental health bed stock. So again, we've kept it in because it's part of the conversation, but it wasn't necessarily part of the data spec. We haven't got CAMS specific assumptions built into it. And a couple of other things on, you know, reference costs, if you want to try and translate again some of the stuff coming out into what the future costs might be for your system. We didn't get the chance and the opportunity, again constrained by time, to build those things in, but hopefully with the data that we've got with some of those resources, you can kind of do those things as a system. There is a button on the bottom. Again, if we go totally public, we may have to take this off, anticipating a deluge, but if you want to click this button, if you're accessing the tool, if you're encountering problems, then it will kind of go through our central SU inbox, and then they'll kind of triage it to us to respond in hopefully a timely manner. So that's kind of super overview. This is the landing page again for people who come at it cold. If you've used the tool before, you're coming back to it second, third time, clearly kind of skip through this, and that's how we've done it. We've again sort of thinking back to the note that we're not resourced to maintain, develop this going forward longer term, and we're trying to wrap all of the instructions, all of the caveats, all of the explanation into this tool. So it might look quite text heavy, more so than previous tools you've accessed. The reason is, like I say, because we're not sort of going to be around, you know, support this substantively, making sure it works. Yes, absolutely, we'll continue to do that as long as we need to, but that kind of wraparound and longer term support, we won't be there. So included all the information, explanation, etc. that we need to in this, so you can kind of pick it up and go and not have to pick up the phone, because we won't fortunately be at the end of the phone. So I will give, like I say, a very super quick tour of the tabs and the linear way we've set it up, and Alex will do all the nuts and bolts, bells and whistles type tour and talk you through exactly how things work. So we've set it up in a very linear way to kind of guide the user through the steps, through the process of modeling. So it includes a tab which gives you some instructions, the ways that you can upload the data and future assumptions you might want to put in. There's a tab which talks you through all the adjustments, the parameters that we've included, and gives an explanation of those. You can see some of those here. We won't have detail to go into all of those. Again, we've got a description, links off to any evidence we've used or data sources we may have used. Within those, some of those baseline sort of default assumptions, like I say, please do scrutinize and critique those yourselves locally. You're the experts who know your system, who probably know the landscape much better than we do, and sort of got your fingers on the pulse of kind of evidence as well. So please do critique and sort of blow all of our defaults out the water, and please do go on your own. It's really just to start the conversation for yourselves locally. We've got an output, various output tabs again, which once you've loaded your data, Alex will show you that they're currently empty because there's no data in there, and kind of guide you through some of the outputs that we've built in. And there's an extra one, like I say, which is kind of post modeling demand. Actually, it's about how the bed flows may change based on assumptions around kind of those in and out of area flows, and also potentially any plans you have around adopting perhaps some or reducing actually a shift to independent settings. We've allowed within all of our parameters, I think, both negative and positive, so you can take any view in terms of increases or decreases in a particular demand or parameter about future bed policies. And again, hopefully within this final tab, we've included information about what the baseline data includes, how we've aggregated that potentially from the baseline data that Andy has constructed and extracted for us, and a glossary down. Again, it's probably not all there in terms of all the terminology that we've used. Again, we may have been perhaps clumsy in terms of some of the language. We've tested it internally and very briefly externally as well to pick up some of these. But again, if there's anything which isn't obvious or clearly explained elsewhere, please do drop us a note and we'll kind of add, we can add to that glossary or an FAQ, to kind of give everyone hopefully that full view of exactly what things mean within the tool. So hopefully the take control option will work now, if Alex can step into the more formal demonstration of all the functions.
Well, I think I'm just going to share my screen because it's a bit bigger, right? So I can.
Yeah, possibly. Yeah, if you do that, and then I will re-pick up when we come back to some scenario planning later on.
Yeah, perfect. So yes, so thank you. So as Andy mentioned, I'll go through a series of kind of mini demonstrations as to how you load your data and adjust your growth parameters and explore the outputs kind of as you would, or as we kind of expect people to kind of work through the tool. So given that, step one is essentially to upload your system's data, which, as we mentioned, will be sent out to you directly. I'll just show what will be in that data. So I've just deleted all of the activity totals, given this is recorded, but this is the format in which the ICB extracts will exist. So we've essentially got a series of groups according to a patient's resident, a patient's demographic information, and some fields on the location and the type of treatment they received. So for each ICB, we'll have pushing kind of 300, 500 rows worth of groups of raw data, essentially, that will feed into the model and then be aggregated within the model. So the reason I wanted to show you this was just to also point to the fact that this, for example, is Nottingham's baseline data, but it does include patients from outside of Nottingham in terms of their residents, or patients who are from Nottingham but have been treated outside. So, for example, if we exclude all of the non Nottingham residents, we can see that there are a number of patients from outside of Nottingham, but all of those patients had their treatment provided to them by the Nottingham ICB in this case. Similarly, if we identify patients who didn't have their care provided to them in Nottingham, we can see that a series of external providers, but all of those patients were kind of residents within Nottingham ICB. So just don't be too confused or thrown by the idea that there's a bit of a mixture of data in there. So if we read in our extract to start with, we can see, first of all, you're being directed to browse a file. And then in this case, we'll select Nottingham. And with a new look, that will then, you'll get visually confirmation that that has been uploaded, and an extract of that data set has been produced for you, just to kind of check that that's done what you expect it to do. On this page, there's also a section about importing parameters, which are linked to our model assumptions. When you kind of pick up the app for the first time, you obviously won't have any preset parameters to import. So first things first is we'll upload the data, and then we'll move on to our modeling assumptions. I'll just also visualize what happens if you do that wrong, because there's almost certainly going to be issues in uploading incorrect file formats, for example. So this is just a sample of a file format that does not meet this kind of criteria, i.e. doesn't have a series of groups and activity counts. So if we were to do that, you can see quite quickly that the app essentially says no. So if you kind of see this at any moment when you're uploading, just try and retrace your steps, reload the app, and make sure that you're trying to import your ICB extract and it meets that file format. Only other thing to add before we move on as well is that this app is kind of hosted by something called a POSIT Connect server. So Connect server up here, and kind of a feature of that is that after an hour of inactivity, for whatever reason, the app will kind of disconnect, and you'll have to essentially start the process again of reloading your data and just setting your parameters if you were kind of mid-session and were pulled away for whatever reason. So we've tried to kind of work our way around that by introducing the ability to kind of export parameters and save them externally and read them in. But just be aware that if for whatever reason it seems to have reset, it's nothing that you've done wrong. It's just after an hour of inactivity that will happen. We sorted our ICB data, and then we move across to our assumptions tab. And a consistent theme of this app as you move through the tabs is that on the left-hand side of the screen, in these kind of grey boxes, you'll have an area where the user is expected to input information, and the kind of main, so this is the kind of side panel, and the main panel will show the output that's created or fixed information that we've kind of either externally derived in the case of a demographic growth projection, or information that we've kind of sourced elsewhere that we should have included references for. So these are essentially all of the parameters that we have factored in the ability to change in terms of you predicting your future demand for spells or bed days. So we've tried to provide definitions and information and kind of background reading that kind of guides our decision making for setting the defaults to what they're kind of set at. But as Andy mentioned, do feel free to change those default variables to whatever more closely suits your local setting. The only growth factor that is hardwired into the model, you could say, is the demographic growth projection, because we've kind of sourced that externally by taking age and gender specific ONS projections for each ICB, and have therefore calculated our projected growth figure for the next 3 years for each of the ICBs, which we then kind of read in directly. So as I say, everything on the left-hand side of the panel is adjustable essentially. So the way to do that is to either just click and type. Let's say for the one we suggest a 7% incidence change on a 5% reduction in waiting list. So you can just interact that way. Similarly, you can just click up and down these arrows. And if for whatever reason, we also fully expect that when you first open this up, you'll probably have a little play around without much direction, which is absolutely fine. You can just click and change, and then if you want to reset that back to what we suggest are the default variables, you can just click this reset growth button. Similarly, on this input tab, we can also download our adjusted parameters. So this is, as I say, this is us trying to enable you to trial a few different scenarios, which I think Andy's going to go through in a bit more detail further on in this presentation. But one approach would be to set like a do nothing approach, where we accept that there's going to be demographic growth, but we want to see the impact of nothing else changing, or how that would affect our future demand. So we can just flick through those, set them as they are, and then we can download those parameters to read in later on. So as you see, I can click the download button. That creates a file into your downloads, which is just a CSV of each of our parameters and the values I've just put in. So the way in which you would use that is back on the instructions tab. Scrolling down from where you input your data, you can also input preset parameters. So here's another function where we select a file. I'll go to my parameters, read that in, and as soon as I've read that in, the parameters in our modeling assumptions tab should now be overwritten with what was in the CSV. So you can see there that we've got back to our 0.000 approach. So just kind of keep that in mind for when you're interacting with the offering different set parameters. It's a case of switching back to the instructions tab, importing them in, and then they'll be kind of evident in the sidebar. For the purpose of this, we'll just reset to our growth figures. So yeah, so having set the growth figures that you expect your system to use, you can then switch forward to our main outputs tab. As you can see, the tool generates a waterfall chart along with a few other outputs that we'll kind of slowly walk through. So we'll focus on the waterfall chart to start with, because these input figures are relating to our occupancy table below. So our waterfall chart essentially displays the kind of projected change in baseline for each of our growth factors in a distinct and kind of iterative way. And that's done for three different measures of demand, I suppose. So bed days that exclude home leave periods, and then spells. So as a user, you can switch between these tabs, and the figures that are visualized will just automatically adjust. Each growth factor can be kind of independently adjusted, and then you should see a change in the output that is produced. So, for example, if we suggested that our default incidence change variable was too small, we can go back, suggest that we're going to have a huge increase in incidence, and we should see a relative increase in the chart there. Similarly, if we suggest that we're going to our prevention program default setting was too low, and we're actually going to see a much larger reduction in demand, we can adjust that, switch back forward to the plot, and we should see a subsequent reduction in, or subsequent change in that bar on the waterfall chart. So each of these distinct changes that are being applied to our baseline have either inflation or a reduction impact on our baseline, which are essentially summed up as we work through each of them to come at a projected 2028 demand figure, in this case for bed days or for spells. So that's essentially the way in which the model takes our assumptions, applies it to the baseline, and creates a future figure. Another way for you to interact with that as an output is to download the projected data. So if we kind of click this download projected data button, we can then open this one up. And this is the kind of format in which the exported data will exist. So again, we start with the data that we input, the kind of grouped fields that we have inputted, and our default, our baseline figures for this ICB in question. And then we'll come back to some of the fields at the end, but then we essentially have a column for each of our growth factors, and we can see that the expected change based on the assumption figure that we've input that this growth factor has on our baseline. So this is referring to there being 27 days bed days for this group of patients, and incidence change for that is apparently 2.7 increase in 2.7 bed days for that specific group. So this kind of can be worked across, and we can therefore manipulate and remove and wrangle with each of the changes that we expect to see based on each of our assumptions. In terms of the occupancy table, so this is our attempt to kind of further contextualize the figures that we're presenting, having controlled for occupancy rates in the kind of baseline and also in the future. So the figures that are presented above are absolute in terms of the count of bed days or count of spells, but we also know that the bed days that are kind of being projected are likely to be variable based on the occupancy rate that the site is going to try to achieve. So this table essentially displays converts the bed days that are being counted at baseline and projected into the future, and converts those bed days into an annualized beds figure according to this formula here. So it's a fairly simple calculation where annualized beds is bed days divided by either the current occupancy rate or the future occupancy rate divided by 365. So the way in which we can adjust and kind of interact with this is that if we focus on the baseline to start with, our assumption we appreciate may be very, very variable across the systems, but our assumption is that the current occupancy rate is somewhere around 92%. Which equates to annualized beds of 386. If we were in fact wrong about that and the current occupancy rate is actually 99%, then we can see that the baseline annualized beds figure therefore reduces because we are operating at a higher occupancy. Similarly, if we're currently at a 92% occupancy rate, but actually in the future we want to handle this amount of demand but at a lower occupancy rate, we can see that when we actually want to have an 80% occupancy, we can see that we're going to need 364 beds for the projected value rather than 355. So it's a fairly quick and easy reactive kind of tool for you to manipulate the number of annualized beds that you may need to provide to meet the certain level of future demand. And can quite quickly be adjusted and returned to our default. So as you can see, as we kind of work through the various tabs after the modeling assumptions kind of stay where they were fixed. So having set the assumptions to what we kind of want them to be, our outputs are generated according to those figures, and similarly our subgroup outputs are generated according to the modeling assumptions in this tab. So the subgroup plots are just quick visualizations of the baseline and projected data according to each of the patient demographic and patient pathway groups within our extract. So we can quite quickly just scroll through and select different grouping variables according to which we present the current projection activity in terms of spells, bed days, and bed days excluding home leave, alongside the projected figures. So you can see at kind of a high level, this configuration of assumptions is projecting a reduction in demand for this ICB, somewhere to the kind of the range of from 2,300 spells down to 200, for example. So for each of our subgroup projections, we're seeing that same proportional increase. So what this isn't doing is applying subgroup specific projections to the baseline group. So there aren't specific assumptions that have been applied to patients from IMD 1 compared to quintile 5. This is applying the modeling assumptions kind of globally to each of the groups. But as I say, it's mostly for kind of illustrative purposes to present the overall change in demand between current and projection and how that might be distributed between various patient groups, primarily as a reflection of the split between groups at baseline. So these are just free to just kind of scroll through and explore. If it was the case that you were wanting to apply subgroup specific growth factors to your patient baseline according to different demographics, that is possible, just not within this kind of tab. You could achieve that by essentially limiting the data you input at the ICB level to, say, if you wanted to do it with IMD quintiles, for example, you take your ICB data at baseline. It looks like this. You'd filter on quintile 1 and import this table at this stage. You could then apply specific IMD quintile 1 assumptions that you've sourced externally to generate the outputs and to generate an IMD quintile 1 specific projection. I don't know if Andy's going to go into that in more detail, but that's kind of broadly the approach you would take. And finally, in terms of my input here, the final tab around bed policy and management is a way for you to kind of manipulate and explore different ways that the projected demand figures could be resourced essentially. Nothing on this tab adjusts that final figure. In this case, 2,000 spells. This tab is a kind of a tool for you to explore how changes in your bed policy management could adjust the flow of patients to meet that 2,000 spell projection. So of the three charts, of the three tables on this tab, the first two, so out of area placements at baseline and provider type and out of area placements at baseline, essentially educate the user to ways in which to interact with the third. So if we start with baseline, what this table does is essentially summarize all of the spells or bed days that the ICB has provided or commissioned and split them out according to whether or not they were for patients who were resident in this case NOTS and treated within NOTS, or whether they were out of area outgoing out of area placements or incoming out of area placements. So what we can see from this, for example, again, you can switch between the metrics that you're interested in. What we can see here is that for Notts County, I think it was, there were 573 external out of area placements that were provided for Notts residents and given or provided outside of that, compared to 122 incoming out of area placements. So what we can kind of say from that is that an ICB is either a net importer or a net exporter of out of area activity, unless in some situation the ICB exports exactly the same number of patients as they import, so to say. So this is worth keeping in mind, because whether an ICB is a net importer or a net exporter will affect the ways in which we interpret these results. Similarly, the second table displays the split of activity by outgoing and incoming out-of-area placements, and also the sector in which those patients were treated. So in this case, for example, we can see of all of the incoming patients for Nottingham and Notts County, there was no independent sector provision for that group of patients. It was all NHS, which is worth keeping in mind when we come to manipulate whether or not we shift or adjust or increase or decrease our shift to independent settings. At baseline, all of incoming placements were NHS provided, whereas outgoing out-of-area placements were primarily provided by the independent sector for this ICB. So in the final table here, this is where we can start to adjust assumptions around our use of out-of-area placements, whether that's an ICB's sending patients externally to be treated, or an ICB's acceptance of other patients coming in from other ICB's residents. So at the moment, our kind of default is a kind of a balance where if we were to 50% to pull back to repatriate 50% of our patients being treated in other ICBs, and similarly return 50% of the patients who were not residents of this ICB but were treated within it, then the impact would be an overall increase in bed days. So you can see that although the assumptions are the same, the impact is an increase because of our baseline position as a net exporter of out-of-area placements. It might be the case that an ICB has more control over the patients that it sends out of areas, whereas it has little to no control over who was coming to them. In which case, you can see the overall impact is an increase. In some situation, the ICB was going to keep sending patients externally because they had to, but was going to completely reduce those that it was accepting. Then you would see the overall impact is a reduction in bed days in this case. Just reset that because that's a crazy scenario. Finally, we can also adjust an ICB's kind of future use of the independent setting. So at the moment it's set to 0. As you can see, no impacted change in bed days based on the use of independent sector. However, if we were to increase the use of the independent setting by 10%, we would see then a subsequent reduction in the need for NHS bed days, given we were going to further rely on independent sector. If we were going to reduce the need for the independent setting or reduce the use of it, then we'd kind of logically see an increase in bed days, because we were going to either not use them more in the future or to pull back patients further on. So we can see that if the kind of direction in which we the kind of polarity, I suppose, of this figure in this input adjusts whether or not you see a figure in this column or this one. Let's reset that. Yeah, and just finally to say as well that although any inputs on this tab don't affect the final projected column in the exported data, they do affect other columns within the exported data. So for example, if we set this to 10 and we go back to export our kind of data we want to manipulate, so we can see with our group data, we can start with our groups, and we also have our baseline activity. Similarly, we have our kind of iterative change based on each of our assumptions for both bed days, BD, or bed days excluding home leave, which you can see more detail on in the metadata tab here. But at the end of our exported output, we've got our projected figures and also group level estimates of the effects of our bed policy figures, our bed policy assumptions, which were again our use of repatriation or expatriation and our use of independent setting. Those figures all align with the final 6 or so columns in our data output there. So that was just to remind you that any changes that you make on the bed policy management would go forward and impact our projected data. I think that was all I planned to go through. Unless, Andy, there's anything else that you think I might have missed on that.
Yeah, thanks, Alex. I think that's it, particularly for the out of area and independent setting. I know it's a kind of a tongue twister. We kept kind of, I suppose, tripping ourselves up in terms of description. I anticipate we might get some queries back on that, but that's fine. If we can articulate that kind of bit of the model any more, so we'll try and endeavour to do so. But yeah, it's just really, I suppose, leaving you with a task of management outside of this model, which is where I'm going to give you an example of now, I guess, in terms of what we'd planned to do in terms of allowing you to scenario stress test some of the assumptions in this. So yeah, all of those little judgments you make on values in the assumptions and those things around sort of where your beds may flow in the future, they all flow through into data that you're going to get out of the tool. So there will be a bit of management. Again, this is probably where to get in your analyst information BI type colleagues to be able to control that and log that and I suppose create an audit trail so that you can review and manage and understand exactly what you're doing with that stuff that's been outputted from the tool. So I'll kind of just now walk you through one example of how I think that scenario testing may sort of play out. Alex has touched on that, I think, as well during some of his demonstrations. So I will now quickly jump out to share my screen again. Can everyone see my version of the model now? Hopefully, yeah. So I'm flicking between. So yeah, Alex has kind of taught you through pretty much all of the different tabs in the model, what they do, how you change the figures, and what that impact that has in terms of the outputs and the data you export out. I don't think I need to linger anymore in terms of the metadata. That's fairly straightforward. It's what the data in the tool means, what it is, and again, some of the terminology, some of the terms, descriptions, what we've inputted in terms of text of the tool, what they mean, or at least what we think they mean. Some of your perspectives, interpretation may vary slightly. Again, that's completely fine. You can add different labels in terms of how you convey this information externally. It's just what we did when we were designing and sort of populating the tool itself. So let's say as a system, you get hold of the tool, you want to start coming up with different scenarios, planning different future states of your bed stock, your population. I think Alex again hinted at one of these might be a demographics only. So literally we'll go through, we'll zero out any of our additional assumptions, which will hopefully, if we do that, give you a kind of a flat line in terms of your model demand. So you can say this is just your demographic scenario. We've got that kind of hardwired 2.4% in the case of Nottingham uplift in terms of your demand, and everything else is kept. This is your do nothing, I suppose, scenario where there's no future changes to our population demand and need, and we're not putting any additional new mitigators in place in terms of offsetting some of that activity. So it's literally baseline plus a bit of demographics. This might be a do nothing or some kind of counterfactual scenario. So effectively what you can do, yeah, as Alex has pointed out, download that projected data, and we'll give you a data file in your downloads, wherever that's gone on my screen. So yeah, that's there. You could save that, probably give it a different name to what it's called as the default, which is just projected data and then the time and date stamp. Again, that will help you kind of organize and audit, I guess, some of these data files as you go forward and think about how they're managed within your kind of next steps. You could even, I suppose, at the ultimate end, feed some of those outputs and different scenarios into Power BI or some other information system you've got locally or your analysts use, which again, you can then start to sync and use and plan around in a very different environment. For now, we're just going to show how they sort of manifest and work in terms of just CSV or Excel exports, just because it's easy to visualize, I guess. So let's say that's one scenario you want to plan around. You've got your export of that data, and then you now want to go back in and do, for example, a really pessimistic view of what your future demand might be. So you do some really harsh, okay, we're going to have loads of, much higher rate of incidence of our sort of key admission categories. We're going to say they're much more acute patients. I mean, this isn't really realistic. But again, gives you a sense of what you might start to do and think about. We're going to think, well, our social care pressures are actually going to increase demand rather than we're going to be able to manage it. All of our national policy things we actually think are going to have very minor effects. The mental health act change, actually, we don't think it's going to manifest either in the time period or actually on the ground. It's not going to make a huge amount of difference. So again, a more conservative estimate of the changes that might have. Actually, we think waiting list management might fail. We actually think we're not going to be able to manage that capacity, all the new demand that's coming through. So we're going to actually, that might be a minor increase in terms of our demand. We're only going to solve a little bit of our prevention in the near term. Changes to service models, discharge pathways, etc. Again, relatively conservative, and our admission avoidance tactics, programs, whatever, again, might not have much impact. So that's going to give you, just if you flick again, probably an upward profile in terms of future demand, a more pessimistic view. So we can flip back again, we can click the button, download, from this screen, download all of that projected data again, and then you've got a second set of data. So that'll be a second Excel file or CSV file you've got to play around with. I'll just show one more again, just to kind of ram home. This is what we'll do, kind of a more, very much more optimistic. So actually we're going to have very small, modest changes on our demand in terms of our population changes. Actually, we're going to do pretty well in terms of getting our social care colleague system sorted out, so we can get people out before they're delayed discharge and all that kind of stuff. So we're going to sort of reduce delayed discharge in the future by 10%. The national policy and investment is going to have a pretty good impact locally, we think. Actually, the mental health impact changes might manifest in terms of local reductions to those formal detentions or the length of stay of those detentions. We're going to get on top of our waiting lists. Again, I'm plucking numbers out of the air. Don't put too much stock in those. We think prevention programs spot on. We're going to save a ridiculous amount of future admissions because of that, and shifts to community models. Again, I suppose locally, and we've not really touched on this, there might be some overlap between some of these assumptions, I guess, or some of these groups of assumptions. So again, it's for you to think about how you might tweak those in terms of the figures that you plug in. You might want to avoid some kind of double count where you think service models and national policy and or prevention might all be kind of having a similar dynamic on those patients. So you might want to slightly offset some of your values with that in mind. Let's just do the last one, admission avoidance again. Look, a more modest one. So again, this is going to have the effect of actually really ramping down that activities, because you're getting quite aggressive assumptions about how you think your service changes investment prevention is going to have on that future activity. So this is a modest demand increase and very serious kind of mitigation scenario, I suppose. So again, you can export that, download the data. You've now got a third set. You could build up as many scenarios as you want by tweaking those kind of modeling assumptions. So what you've got then effectively is a whole group of data of different scenarios based on your baseline and your assumptions, which what I've done just to reduce the amount of steps within this part of the demonstration is to create a kind of an amalgamated or compiled file of those different scenarios. So you can see this is just, again, as Alex has showed, all of those different outputs, all of the different rows of data. All I've done after I've compiled each one is to give it a scenario number and a name. In this case, it's either our default, or it's a demographics only, or it's a optimistic or a pessimistic. So there's going to be a bit of a job, again, to manage what you get out of the model in terms of how you use that in the future. We've not been able to build in all the functionality that we could potentially envisage. So this is just one way of doing it. And then what you can do now, you've got this kind of merged list data file of all your scenarios. You can start to maybe add some pivots, or, like I say, feed it in ultimately, potentially, maybe to a nice whizzy system that you got your own Power BI tool or other things you could sort of merge this kind of data with. And so this will then give you that comparison. So you've got 4 different sets of data, all on the same baseline, but with different assumptions. You can very quickly get a sense of, well, based on our demographic only assumption, the bed increase may be this, or under an optimistic scenario, the bed reduction might be this ultimately, and similarly with all of those different scenarios. So again, you can start to overlay different filters and different views on that baseline and model data. This is one you can notice. I forgot to change when I was building this up, 0.1, I think, of a percentage of that acuity factor. So actually, although this should be a naught, so be very careful when you're actually storing and saving, I guess, your values, because they do impact on this flow through of information. So again, this gives you a sense of, at least within our model construct and the baseline data, where those are in terms of those different scenarios. So again, that's a very crude, I guess, way of describing the process as to how we think it might be used for scenario planning. Again, people are creative, analysts are very creative at how they might utilize some of these outputs. So again, it's very much for you to take the data, play around with it. Another thing that I think you probably could do fairly easily, so some of the limitations are that these are global figures. So taking, for example, one of these exports, I mean, the scenario is irrelevant, I suppose, to this, but actually what you could do if you've got your demographic assumption somewhere here, let me just find one. This one will do. So this gives the global demographic thing, but actually if you wanted to have a more localized, more specific demographic factor, actually what you could do within your export, and again, you'd need to make a record and a note of this. I guess you could add a completely new tab or a new field. But if you wanted to overwrite this with another local, more specific assumption, you could have a formula in there which actually gave different demographic adjustments based on the very specific age group or IMD quintiles. If you thought actually the more deprived sectors of your community might be having different challenges, different drivers in terms of demographics or demand, you can sort of overwrite almost some of these demographic things. Like I say, you're going to want to, if you do that, obviously keep a record and note of what those changes are, so that you know how they varied from at least what our default model is doing. But again, it's kind of open because it's an Excel. It's a very flat output that you can manipulate and change however you want to do it. That's completely up to you. But again, just keep a note, and when you report these things back into your strategies, back to the region, any national planning processes, then obviously you need to make a record and be explicit about what you've done differently, I guess, compared to our defaults. So that it is obvious to the end user and they know exactly what you've done and how your planning may vary. So there are things I think we anticipate in the short term that you're going to want to do and see and use the model for. So I think we'll kind of stop the demonstration at that point. I think there's additional things just to describe. If I go back to maybe a training slide, I think we've got an open. Oh no, we don't have an open question thing. So I think we'll probably just call it there in terms of the formal demonstration. Before we go to questions, and we probably truncate the video for training purposes, I suppose that there's some of the things which you may want to consider doing. I suppose given some of the limitations and the functionality we didn't have time or couldn't build in necessarily to the system. Some of those things I've already mentioned, the scenarios I mentioned, kind of changing some of those defaults post-model. You might want, again, Alex touched on perhaps dividing up either your inputs to the model or the outputs and then rebuilding them to accommodate some of those subgroups. So you might want to perhaps treat the in and out of area beds completely differently in terms of assumptions, in which case, great, you can either load in just that subset of activity or you can filter it out at a later point. You could do it at either point. There's no... Again, we're not advocating for one or the other. Again, it's just about managing your thoughts, being explicit about what data you're feeding in and what you're doing with it when it comes out. Like I say, you could convert some of those bed day adjustments in the exports to beds. So we've converted them in beds in the output just on the aggregate data and not for all the interval steps as well, all the interim assumptions. So again, because we've laid out the formula, that's again quite easy to do. If you want to see some of the bed impacts of any of those specific interventions, those mitigation or demand factors, you can do that with a very simple formula. So again, we didn't quite get a chance to build all of that in, but you can do it fairly easily, sort of post model with the outputs that you can kick out. So that's essentially it. Like I say, the next steps, obviously you should be contacted, or at least the nominated colleagues that we've got a list of will be contacted by either our server colleagues in data science or from us to sort of walk through that access process to share your data file that you will, your baseline file that you will feed in. Obviously, like I say, we're not going to develop the model more, but what we will do is maintain and support that obviously access point of view. And if anything does break, doesn't work as intended, or if there's any clarity required, we'll kind of tweak things and, like I say, develop a live FAQ kind of document to support that. And I think probably again back to Diane to tie that up in terms of the next steps. But yeah, maybe we'll just pause there in terms of the demonstration, the video, and then we'll perhaps have some questions on that before we hand back to Di to close up, if that's okay.